We will continue by discussing now current trends in biopharma investment and mergers and acquisitions. And as before, we now have the Managing Director of Healthcare Investment Banking at West Park Capital, Tara Sharif. Welcome.
Thank you very much. So I realize that this is a digital health conference, but I would like to present to you a more broad spectrum of what is being invested currently, what are the hot areas in the life sciences and healthcare in general. So I'll be giving more of a broad picture, which of course will include the digital health. So first of all, the per capita spending on healthcare all over the world is only increasing. So I guess that is good news for investors, developers, scientists. As you can see from this picture, in almost every country in the world, 2018 represents the orange, much higher investment or per capita spending. Of course, the US is the king of spending on healthcare. We are doing even more than we were doing in the past. So that is one thing that is for sure. Now, what is driving the growth in this sector? At least in the US, I can present with some areas that pushing this even further ahead. The drivers would be that investors, meaning individuals, funds, are demanding. They're interested in putting their money in healthcare and life sciences, which is a good thing. That drives the growth. Secondly, there is a lot of innovation that is being done, so healthcare is becoming more interesting, more effective. We are doing a whole lot better as a whole, as a sector, treating some diseases such as cancer. We have made huge progress recently. So that's the second element. And there is a huge push to develop drugs that are called specialty or rare drugs that are addressing smaller populations. In the US, a rare or orphan drug designation is given to one that treats a population of 200,000 or less. So if you can imagine, these are addressing rare genetic diseases and diseases that were not addressed before, but now there's a lot of push for it for two reasons. The economics are good. The return on investment on these drugs are better than ever. And there's more being done and the capabilities are higher on that rate. I'll show you some numbers on that. And the last thing that I think is contributing to this growth is a lot of collaboration. Mergers, acquisitions, licensing. So that is a collaborative growth that infuses more and more novel ideas into this whole sector. So let's look at some of that data. The investment demand, take a look at this. We have had, in the last 6 months of 2014, you see the bar, that's investment in healthcare. IPOs higher than they have been since 2000. IPOs, follow-ons, and convertible investments are tremendously high. Why do people want to invest in healthcare? Where is that interest come from? For one thing, the interest rates, at least in the US, have been so low, lower than ever, that people don't want to put their money in the bank and collect essentially zero on it. So there's investment in assets that will grow. And people realize that healthcare is one thing that we are willing to spend money on. And also globally, we are meeting the demand of the emerging markets. So therefore, the growth. I told you about innovation is one of the elements. Biologics, these are the more complicated therapeutics. These are monoclonal antibodies. These are more complex products, but they're gaining momentum. As difficult as they are to be developed, they're also selling higher because they are addressing the diseases that were very resistant to treatment by pills. So that is why biologics are on the rise. This is showing the follow-ons, which is the investment after an initial IPO. There's more selling of shares. Of follow-ons in the biotech sector has been quite high in 2015. So biotech, everybody, is coming to the forefront of healthcare. There was a time that it was all pharma, the big pharma. Now biotech is gaining momentum because they're offering better and more complicated drugs. A friend of mine and I kind of started looking at what moves the stocks. We would look at the stock and say, whenever there was a shift, usually an uptick, we look and saw kind of retrospectively what made this move. And what we found was, of the more obvious reasons, like earning announcements, mergers, regulatory decisions, FDA approval of drugs, but the most effectively contributing to the uptick in the stock price was release of data. So what is selling now is if you have an exciting data, your clinical trials worked, in other words, pushing the frontiers of the healthcare and life sciences, that contributes to the uptick in the price, which is why then the biotech is selling more. I told you that innovation / biotech, all of that good stuff is on the rise. Take a look at this. This is almost 70%, more than 70% of drugs that are being developed now in the different areas, neurology, cardiovascular, and so on, are what we called first in class. This is as opposed to the Me Too products that are slightly different from what we had before. Like, you know, everybody has a cholesterol drug, but these are the ones that are first in class, meaning that they're treating symptoms and drug diseases that had not been met before. So again, innovation is on the rise. Take a look at this. We have been able to really treat cancer in ways that we were not able to do it before. Recently, the most recent years, most of the cancers have had a downturn. This is the death rate of different types of cancers, lung and so on. Of course, some of this was corrected by the correcting of the behavior, like cessation of smoking, but on the other hand, we have had better drugs than we ever had before. So that's good news. I told you about orphan or rare drugs, the drugs addressing less than 200,000 people on the rise. Why is that? Because you make more money addressing those drugs. It's simple mathematics. This is just the earning on the orphan drug sales and this percentage of orphan or rare versus prescription drugs. I'll give you one example. There's a company that's making one drug that treats two rare blood diseases. The cost to the patient is around $500,000 per year, but somehow if people are desperate, they find a way to pay for it. And so a lot of companies are now making orphan drugs. The other element of contributing to growth of our industry is that FDA, our regulatory agency, has become a little bit more friendly. They realize that they need to be more friendly, especially to innovative products. And if you look at this, the number of approved drugs versus whatever was filed has increased. So that is also encouraging. FDA to be also commended for having this called breakthrough therapy designation. So they facilitate and progress these drugs that are offering treatments that have never been offered before. So if you have something really novel, FDA is willing to work with you. Now, when you look at all of this innovation and excitement and all these novel things, you think that that means more cost. But if you look at the data, the amount of approval by the FDA has increased really in the last few years, and yet the expenditure on development of drugs and biologics has not really gone up. So why is that? How can we grow more and make more money with not spending more? And in my opinion, the way that this is done is through collaborative effort. There was a time that each company would go to sources of money and they would raise millions of dollars and do it on their own. So clearly that becomes more and more expensive. But now companies work at earlier stage together. They partner, they put the pieces of the work together. There's a lot of synergistic collaboration that contributes to this. As an example, M&A is on the rise. So to substantiate what I was saying before, we have never had as much mergers and acquisitions that we have had in 2014. In the number and in the amount of money all over the world, mergers and acquisitions are on the rise. What are the drivers? Why do people do that? Other than the clearly cutting the costs, but there are other strategic reasons for this. First, big pharma needs bio. They realize that they can't make it, and so they look to younger company, universities, smart, young, hungry people at the level that they could contribute more meaningfully. So in that sense, from the R&D, R has gone down, and most of the big companies are concentrating on D, the development. So what happens is that they go to smaller companies, universities, and work with them and buy those assets from them. So that's one reason. And you see a frenzy of activity here. The companies buying each other for these reasons. And these are the big players that buy younger companies for different reasons. And then there's a strategic reasons. For instance, working with Foundation Medicine that is doing a lot of genetic testing and so on, it will help a big player to work with a younger one. And pricing power, and then there's different reasons. I forgot to mention that tax inversion it's become something very big in the US. A lot of big US companies don't like to pay the high taxes that corporations pay, so they buy an offshore company in Ireland and so on, where the taxes are more friendly, so that has contributed to the M&A activity. So I have 5 more minutes and I have 4 more slides, and I want to tell you what is happening now. As you can imagine, there's a lot of demand for assets, right? And there's in fact shortage of assets. So there's a commercial opportunity here for young companies to come up with assets that they will get picked up for very good valuations. But how do we get to that point? And in America, we call going from an idea or a concept to a product that you can sell. These guys have to go through so-called the valley of death because it's a hostile environment and a lot of them die. So there's a demand for obvious reasons, and that demand you can see is that the big pharma is buying assets at earlier and earlier stages. So there was a time that there had to be at least good clinical efficacy data, phase 2 being done, but now they're being purchased, the assets that are even younger and earlier. So there has been a huge number of licensing of products that are even at the preclinical or earlier stages of development, unprecedented. So, but how can we do that again? Go through this valley of death. There's a lot of tremendous amount of effort is being done because everybody realizes that. Now people are caught on and everybody wants to work with universities and establishing incubators, and there are funds that are given and there's accelerators and incubators, but a lot of these efforts seem to be slightly fragmented. So meaning that there's work that's being done, but they're not cohesive, not a complete path of growth. Academic universities file the IP, but not a whole lot more. We have incubators and so on. But a lot of times, the grants that are given 50,000 or 100,000, $500,000 to a company is not going to get them really that far. They offer mentorship, that's also small. So, in general, I feel that there has to be more interactive and global effort to put the pieces together to kind of make this path to growth a little bit more complete, so that young companies know where to go from the beginning to the point that they can be a liquidity event. So I'm just presenting what I think at this point. This is my thinking and idea, and I would love to talk to you if some of you have some ideas about how to really make this opportunity a reality and put the pieces of the drivers of innovation together in a collaboration. When you look at who are the people who contribute to making of a therapeutic or a drug, it's not like making a small, like a piece of art or a piece of glass. The drugs are very complicated. The development of them are very complicated. So there are so many pieces that are needed to take a technology that has a patent file on it to bring it to liquidity event. We need entrepreneurs in residence, meaning people that, other than the scientists, people who have been there, done that, they know how to run a company. There's a lot of lawyers involved, investors, CROs, contract research organizations, strategic investors. We need help from people that can advise you on regulatory approval process, marketing, and so on. So it's a dizzyingly, hugely complex process. So then how a scientist who has had this most amazing technology can go and reach out to all these elements to make this a reality. As I said, there's some help that is given, but it's fragmented. So here's the opportunity I feel that exists. What about if you put together a free for everybody, web-based, global, interactive reach out where individuals place the need. So it's like at every stage of growth, a small company or an entrepreneur, they place their need and they say they need, for instance, toxicology or PK/PD work, and then maybe some CRO somewhere in the world is willing to work with them and they can negotiate on the upside. So there's less demand for money and capital at that stage, more collaboration, and once these companies gain some momentum and critical mass, then they can go to investors, and then they can go to big players. At the earliest stage, it's essentially very difficult to do it, and nobody knows how to do it. So I'm proposing maybe we should put together something like this, and this is the world is becoming one unit, really. I mean, somebody somewhere corner of the world can participate in the next phase of the growth, and if we can put the pieces together, everybody, in my opinion, will benefit. So I have the domain so far set, biorelay.com, and I would love to, if you guys want to, if you think this is a good idea, I would like to work with me. That would make me very happy, both as a previous scientist and as a banker, because I think that's the way we can propel this forward. And so that's my talk, and thank you very much.